Back on Go. Just last year, a new statistic revealed that Cuyahoga County has the highest Alzheimer's rate in the state. And now there is a groundbreaking shift in Medicare policy taking place that covers caregiving support at no cost to people living with that and other forms of dementia in Cleveland. It's called the GUIDE program. This is a topic that impacts many of us, certainly. And joining us now to tell us more about this is Rabbi Shalome Plotkin, who has been piloting the program, and caregiver Linda Lyle. I'd like to thank both of you for being here this morning to talk about something that is very important.
Thank you for bringing us, Dave.
Yeah, and real quick, let me hear it. Your name?
My name is Shalom from Right at Home. Shalom at home.
Shalom at home. There you have it. All right, that's good. So GUIDE stands for Guiding and Improved Dementia Experience. Can you fill us in on this program?
Sure. It's pretty revolutionary. CMS, this is Medicare, said we're going to give about $2,500 to a family member or a friend, someone who has dementia, and you can maybe take a 3-day long weekend. One of my professional caregivers can sit with and support our client, and maybe they can just take a break. It's once a year, it refills annually, but they gave us 8 years. They gave us a long runway on this program to see how it works. And if we can reduce the stress for some of our caregivers, that would be awesome.
Yeah, the stress has to be high, right?
Trying to avoid burnout.
Yeah. So it's not just for the patients too, it offers resources and training for the caregivers.
Right, so we have a partner called Pocket RN, and they're virtual, so they're basically telehealth. There's a nurse available 24/7, and so our clients can call the nurse. They have care coordination, education, they also have resources. So yeah, it's kind of a wraparound service, which helps the person with dementia to be able to age in place with a little bit of more grace and dignity.
So you own Right at Home?
I do. So I'm the owner of the local franchises on the east side. We have about maybe 20 offices in the state.
Okay. Tell everyone how you started it.
The whole goal was to try to keep my father-in-law, to try to keep Dad at home. And he actually kind of didn't want a caregiver, but it was getting to be too much for Mom. And what he really wanted to live at home, just be where he was comfortable. Yeah, we miss him. Yeah. But yeah, that was how we got started. That was 10, 12 years ago.
And what can this do for people right at home?
Our whole goal is to help our clients in their homes. So the right care, right at home. We bring caregivers like Linda, and we connect with our clients. And then hopefully, over the years, they get to know each other. Maybe we can help them to have a better day. It's just one day at a time. It's simple. Cooking, cleaning in the house, personal hygiene, we drive.
Yeah.
Linda had an amazing experience with her client this past Friday.
Fill us in.
Yeah, actually, I took her to the Cleveland Botanical Gardens. So, yeah.
Beautiful weather. They had an outing.
Yeah,
it was amazing.
It was beautiful. Yeah, like he said, beautiful weather. It was nice and less humid and stuff like that.
And they've gotten to know each other over some time. So, you know, had to transfer her. So she's typically bedbound. Get her into the wheelchair, into the car.
Yeah.
That picture that you took, that was beautiful.
Thank you. Yeah.
How do you connect with your clients, Linda?
You basically, over time, you know, you got to get to know them. Like with my client that I watch full time, it's just, you know, I sit with her, you know, and I'm literally right by her for 8 hours a day, you know, and it's like, it's almost like having a second mom. I mean, really, I mean, because she's about my mom's age.
You do get attached to
You
them,
do, very
don't
much.
you?
Yes, very much so. Yes, very much so.
And do you realize how important you are to these people?
Yeah, I think I do. Yeah, I do. Yeah.
How about dealing with the families that have to deal with this disease? Because, I mean, it's so difficult on them.
Yeah. Well, my client that I sit with, she's got Parkinson's, and I think her family realized with having that, you know, eventually, you know, that was, it happens. You know, it's just kind of a part, like Shalom was saying, it's a part of that disease process. So I think they were kind of prepared for it, but you know, it's I worked in nursing homes when I was younger and stuff like that, and sometimes it's very hard, you know, for the family to watch them transition from being, you know, functionally normal to now, you know, not completely dependent on, you know, a caregiver to feed them and, you know, take care of their personal needs and stuff like that.
Running short on time here, but any major tip or any tips you have for families dealing with loved ones that have dementia?
just take one day at a time. Talk to other people. There's Alzheimer's support groups and stuff like that. Those are good.
In the hot weather, I would say staying hydrated is probably a good idea.
Yeah.
And Shalom, how can people qualify?
So they can call us. We'll help them. Our number is 216-752-2222.
Okay.
So we answer the phone around the clock.
Yeah, well, I really appreciate the time. As I told you before we came on, my grandfather had Alzheimer's, my mom had dementia, so I really appreciate, for me and everyone at home appreciates all that you guys both do.
Thank you very much.
Thank
you
you.
very
Thank
much
you.
for taking the time to be on this morning.
Sure.
Real
Thank you
important.
Thank you
so
for
much.
inviting us.
Thank you.
Yeah, all right. Bristol, let's send it back to you.